was a complete surprise to me when I got a phone call from the Australia Day Council saying I've been nominated for the ACT Australian of the Year award. And I was nominated, as I understand, by two mothers and a staff member. The mothers had a baby with us in the NICU, and they were very much involved in the planning of the new NICU that we have here at the Centenary Hospital for Women and Children. The staff member has worked here many years and worked very closely with me and was also integral to the planning of the new NICU. So that was very surprising, and I feel incredibly honoured that they put my name forward and thought that was so special, what we've done, that it was worth a nomination. I believe I've been awarded the ACT Australian of the Year because of my passion to involve families in the care of the babies. Here in Canberra, in the neonatal department, we have pioneered the NICU cam. That's a webcam for families who cannot come and visit their baby, or who would like to just be reassured that their baby's okay at the end of a day, or would like to show their baby off to relatives who are overseas. In addition, we have involved family from the word go when we started planning this NICU. Not only have we involved them, we have asked them, what is it really like to spend weeks and weeks in a hospital at the bedside of your baby whilst you still have either a job or you've got other children to look after or partner at home. And they made us listen, they made us understand. They were the specialists, they know what they were talking about. And because we listened and we heard them and changed the way the NICU was originally planned to what we have now, a really family-friendly, patient-centred neonatal intensive care unit, the families have put my name forward. Now, we just think we're just doing our job, but obviously it's a bit more than just doing our job. And thought that that was special, and that's something that other people outside of Canberra and outside of the NICU need to hear, and the award got given for the involving the families. Just to give you a bit of background, I was born in Germany to a German mother and a Hungarian father. I've learned to speak English in the States with my family there, and I studied medicine in Germany, in Switzerland and in the States, so I've been around a bit. I came to Australia in 1994, just for a year initially, to do some research. And it took about a month, no more than that, for me to fall in love with the country and with the people. The decision to become an Australian was a very deliberate decision, because I will lose my German citizenship, changing citizenships, becoming an Australian. So it's something that I really wanted, something that was very close to my heart, because this is the country that I chose as my home country, where I want to raise my family and where I want to spend the rest of my life. To me, being an Australian means to be proud of a country that is very young, a country that still has to learn, but a country that is developing faster than we can think. A country that has great history that goes back thousands of years, a country that appreciates the underdog, a country that's about support, mateship, helping your neighbours, a country that's showing other countries that you can accept and live with and be partners with and neighbour with and love people coming from different cultural backgrounds, from other countries, people who have different religions, and we can show them what true multiculturalism really means. It's a real mix of people that makes Australia so unique and gives it its special flair. I was so honoured to be told that I was the choice, that I was the ACT Australian of the Year. And it's just so exciting to now use my voice and to realise the potential. Because what I want to do is tell our story to the rest of Australia, to get across to people that involving families isn't just for the benefit of the families, but is actually to the healthcare benefit as well. It makes healthcare easier, it makes planning of a new NICU easier, it changes the way we think about patients, and this is the unique opportunity for me to have a voice and to bring that voice of what we have achieved here in the ACT out to the rest of Australia. My passion is to ensure that families and patients are involved in their care. Now, what do I mean by that? Traditionally, a patient would go to a doctor, a diagnosis was made, and the doctor would make the decision about what treatment was required. This is not how medicine should be practiced or is practiced these days. Nowadays, families and patients are real partners. They get given information, they have options in treatment plans, and they have a real choice in what's going to happen to their healthcare. And that's something that's very important, that's of benefit to the families and that's of benefit to us. And I want to ensure that everybody realises these benefits, and especially that the families and the patient realise how important it is for their care to be involved and to have a voice. Family-centred care isn't that hard, really. Family-centred care means you involve the patient in everything that you do. And that is treating them as you would like to be treated. It starts with asking them about their values, about their preferences, about what they expect out of the treatment or out of the care period or out of the consultation. But let me just give you an example about what I mean. We had a baby in our NICU that was very unwell. The mother was very unwell as well, and the partner was walking between the baby and the mother, obviously very stressed. I could have just decided to treat this baby with a drug that I chose or that I thought would be the best for this baby. However, this drug was a rather unusual drug, and I needed to ensure that the family understood what I was aiming for and what the risks were. So at 3 in the morning, the three of us sat together. I was quite open. I talked to them about the risks and the benefits of the treatment, and both agreed. We took the responsibility together. We made the decision together. This was a great outcome because the baby responded very well to the drug, but it's the whole process that made the difference. So it is about giving information, understanding where the family is coming from, because every family is unique and every family is different, listening to them, and then together making the decision and taking the responsibility and the good outcome together in the end. We've changed a lot over the last few decades, really, in the way we involve the families. And it starts with talking to families before the babies are born, making plans about the delivery of the baby and the treatment that the baby may require, and their choices there as well. If we talk to a family about blood transfusion, it's often the fathers who would like to donate blood for their baby, so we have a talk about that. We, when the baby is born, include the families, of course, in all kinds of decision making, but we let them be a partner on the ward rounds. In the mornings, when the doctors and the nurses do the handover and make a plan for the day, the parents are there, they can ask questions, we can discuss the plan for the day, and we can change timing of certain interventions that we would like to do based on what the families believe is important, whether they want to be present or not. More importantly, we try to get across to the parents that's very important that although the babies are very little and look very sick, that the parents are there. And when I mean they're there, is they're allowed to hold them. They should talk to them. Babies, even premature babies, can differentiate the smell of the mother from the smell of another woman. Babies know their partner's voice because I've heard it for a long time. So being there, being close, holding the baby is one of the things we do. And in addition, we let the parents take care of their baby. So even the little ones, we let them change their nappy. We show them how to feed the baby, measure the temperature. We explain to them what the monitors, the beeps and the noises all mean. So they're really learning how to deal with their baby. They understand what their baby is going through, and they help the baby in the healing, and they work with us, and they know their baby best. So we like having them there because we can ask them about the condition of the baby, whether it's changed or not, because they're the specialists. So I talked a lot about the babies, but this goes further than that. This is for every patient and every family, and I think it's important to understand that you have a voice. You need to be brave and talk to your healthcare professional. Talk about your values, talk about your beliefs, talk about what's important for you, and talk about how you can take charge of your health, whether that be in the hospital or in the community or at home. Ask the questions. We can explain things so you can understand them, and you do have choices, and make it so it fits your family and your healthcare. Talk about how important it is to have your family or your partner present at the bedside so they don't get chased out during rest period. Make it your health. Take responsibility. Tell us what you need and we will try and help you achieve that.